and welcome to our GEICO Group Ethics Case Competition presentation. We decided to focus our presentation on how healthcare in the U.S. is normally treated like a business. I'm Shannon Smith. I am a freshman at Bauer pursuing a degree in marketing. I was the lead for internal and external communication with our mentor, and I was one of the lead writers for this presentation.
My name is Gary Chang, and I'm a freshman, and I'm currently pursuing supply chain, and I handled the internal research for our project.
My name is Christina Almud. I'm a freshman considering finance, and I was in charge of communication among the group, as well as information about the overview of U.S. healthcare.
Hi, my name is Jumbo. I'm junior in finance, and I have with contrast statement and with the PowerPoint graphics.
Hello, I'm Shirawan Wansi. I am a junior pursuing marketing. I set up the outline for this project, track out the project milestone, and I am responsible for the future of the healthcare section.
Hi, my name is Senai Mikhail, majoring in accounting and finance, and I'm responsible for the PowerPoint and contradicting statements.
Hello, I'm Jennifer Cabrera, and I'm a junior pursuing finance. I was in charge of creating this PowerPoint and as well as incorporating key points regarding our research-based project.
So a brief summary of our presentation and how healthcare is actually being treated like a business is the perception that healthcare practice has changed and now it is more of a healthcare business in the United States. The concept of the doctor-patient relationship has also changed, and the language has changed as well. And it now highlights how the customer is always right, creating the doctor to become just some opponent against them or just that huge force that they just can't overcome. So an overview of healthcare statistics in the US is about 91.5% of the US population has health insurance, leaving about 8.5% of the population uninsured, which doesn't seem like it'd be a big number, but it is definitely a big number. Of those 91.5%, about 67.3% are insured through private insurance, and the rest are insured through various government programs. About half of the US population is insured through their employer through employee benefits, meaning working full-time and just committing to that job. So the US is the only member among the 37 nations part of the Organization for Economic Cooperation and Development that does not have universal health care in practice or by constitutional right, which seems pretty bad. So in comparison from us to other developed countries, we devote more of our national income to healthcare, totaling about $3.6 trillion, and that accounted for 17.7% of the US gross domestic product in 2018. Usually higher healthcare or a higher amount of spending on this healthcare usually ends up with great results or above average results. Unfortunately, that is not the case in the US. Despite us spending a significantly higher amount of money than other countries, our healthcare outcomes are not any better than the other developed countries. There are some treatments like insulin, for example, which are so much cheaper in Canada because they have price controls on these pharmaceuticals, and those price controls are sent by a review board. The US doesn't have these price regulations on these pharmaceuticals, leading it to be extremely just detrimental to these poor patients who can't afford some of these treatments like insulin.
So there's three problems with the U.S. healthcare system that we found, and the first one was a lack of insurance coverage, and more than 27 million people, or about 1 in 10 people in the U.S., are uninsured because they can't afford any coverage. And the second one was, since different insurance plans cover different treatments and procedures, doctors waste time coordinating with insurance companies to provide care. And this inefficiency wastes a lot of money on administration costs throughout insurance companies. And the last one is underperforming primary care. So primary care is fragmented in the sense that many primary care physicians struggle to receive relevant clinical information from specialists in hospitals, and that would prevent coordinated care between doctors. And then there's many impacts of the U.S. economy has from healthcare, and one of them would be the patchwork that U.S. healthcare system causes economic distortions that would negatively affect the economy. Another one is that the relationship between the U.S. economy and healthcare spending growth is multidimensional and inherently complex. And then healthcare is rapidly rising in spending and affecting to lower the rate of GDP and growing and overall unemployment. So for the solutions of the U.S. healthcare system, there's changing the way the federal programs pay for healthcare to encourage providers to deliver better care and eliminate unnecessary services and waste and operate more efficiently. And another one is making the cost of healthcare more visible to beneficiaries. So basically, you encourage them to be more involved in healthcare decisions. For example, by designing copayments and deductibles to make patients more aware of costs, by using different amounts of copays and deductibles to encourage patients to select higher value care options. And another one would be reducing federal healthcare subsidies. These options would continue to make the programs available, but would limit federal costs. For Medicare, options include raising the eligibility age, increasing premiums, and increasing taxes on benefits, which would reduce the level of financial assistance provided to higher income beneficiaries. On the contrary, although all of these things would benefit the healthcare system a lot of people would still make the argument that these would increase taxes for people because they would have to basically pay for all these Medicare systems.
So this is a feature of the U.S. healthcare. Possible ways that Joe Biden winning presidency could impact the U.S. healthcare. As we all know, the reduction of uninsured population and increase affordability of healthcare by expanding the Affordable Care Act. And what is the Affordable Health Care Act? It has gained a net increase in the number of individuals with insurance, primarily through Medicaid expansion. The reduction in cost is an arguable achievement, while quality of care has seemingly not improved. Medicare for All Who Want It has proposed an increased access to Medicare to all through supplemental Medicare plans. And Medicare for All Who Want It proposals increase access to Medicare to all while maintaining a role for private insurers through supplemental Medicare. Well, I just repeated that. With that recommendations that we have, we recommend that the United States should have more reformed healthcare systems in order to provide for those who need it most. And in conclusion, with that being said, the perception of healthcare has developed more into a business. The aspect of doctor-patient relationship has changed, and patients have to fight for the treatments they need because it's more business-like, and the perception of healthcare has become more into, has become more of an aspect of business-like. That leaves a lot of families in huge amounts of debt for easy-to-make pharmaceuticals. Therefore, in order to better our country, we should try to reform healthcare and make it less business-like and more about practice and helping the families who need it. And these are our works cited page.